The digital ECG reporting service has been developed to support rural clinicians to provide world-class cardiac care to patients presenting to urgent care centres with chest pain and acute coronary syndromes. High-resolution digital ECG images taken at an urgent care centre can be shared through a server and accessed by GPs, regional emergency department doctors and physicians to provide the right level of cardiac care in the right place at the right time. Ambulance Victoria can also access these digital ECG images when a patient is transferred from a rural health service for cardiac intervention or to the closest regional health service for further management. Most patients presenting with chest pain will be managed locally by the GP and nursing staff. The digital ECG reporting service complements and is integrated into existing processes to support rural clinicians manage patients with chest pain and acute coronary syndromes. This video will step you through the use of the Philips digital ECG cart and how the transfer of digital ECGs are integrated into patient care pathways. However, it does not go into detail on the medical management of patients. We also explain the importance of entering accurate patient information at the time of the ECG capture to make sure your patient gets the clinical benefits of having retrievable digital ECG records, not just at the time of presentation, but also into the future. We will explain the use of the iECG or IntelliSpace ECG, the desktop interface that is used to access digital ECG images stored on a server. Features of iECG include verification of patient details and reporting of ECGs by medical officers. When a patient presents at an urgent care centre with chest pain or acute coronary syndrome, you'll be very familiar with one of the first tests performed as outlined in the Hume algorithm, that being an ECG.
So I'm going to do an ECG here to find out if there's anything wrong with your heart.
You may also be very familiar with using a Philips ECG card. However, there are a couple of mandatory fields to input to enable the digital ECG reporting service. The patient UR number. If the patient has previously presented at the urgent care centre, simply retrieve it from their file. If the patient has not previously presented, a UR number must be allocated to enable the transfer of the digital ECG.
Have you been a patient here at this hospital before? No. Okay, so I'm going to give you a UR number and that will be your number for this hospital, okay?
And the second mandatory field is the department name.
And we put in our department, which is Alpine Health Urgent Care Centre. Okay.
After capturing the ECG trace, press the transfer button to send the image to the server.
So John, now that I've captured the ECG, I'm going to transfer this ECG so the GPs can look at it.
If there is no network or internet availability, this could be due to a network or local Wi-Fi outage. The process will be slightly different. Allocate a UR number when the network is re-established from the PAS, or if the patient has not attended the health service before, the pre-prepared UR number list. First, we will take you through the use of the application iECG, which can be accessed by using your health service login or any health service computer. The first step is to locate the iECG icon on your desktop. Not every computer has the same setup, so it might be different in your location. Speak to your local ICT team if you need assistance. Click the icon to launch the application's login screen. Enter your username, password, and domain, which will be the same as your hospital computer login. It's a good idea to familiarise yourself with the login process and application outside of a clinical event. Having successfully logged into the iECG application, you'll be presented with a quick search screen with search types on the left and a number of drop-down menus on the right that enable you to limit your search criteria. In most cases, you'll be searching for an unconfirmed ECG in a known location. Select the Unconfirmed ECGs option on the left of the screen, then refine your search by location. The institution represents the regional catchment for health service delivery. In this example, Hume NHW for Hume Northeast Health Wangaratta. The facility drop-down menu displays the region's health services and the department displays the departments within those health services, such as an urgent care centre, inpatient ward, emergency department or critical care unit, etc. Ensure that the duration of the search fields captures the date the ECG was taken. In this case, we'll select 2 days. Next, click Search to display the list of patients and ECGs taken. The search results are displayed in chronological order, and the most recent ECG presenting at the top of the search list. Having located the correct ECG, double-click on the patient's name to display the ECG. If multiple ECGs have been taken for that patient, they can be viewed in the tabs at the top of the screen. Click on the tabs to view the ECGs. Let's take a moment to familiarise ourselves with the options at the top of the screen. Within iECG, clinicians have roles. Nurses are verifiers. This role allows for patient details to be changed only before an ECG has been reported by a medical officer. The role also allows for Print, where you can print the ECG, Verify, where demographics are verified for an ECG, and Compare, where an ECG can be compared against a previous study. After an ECG report has been confirmed, patient information is not modifiable. If you are interested in looking at the ECG in detail, there are a number of functions within the system that allows for a comprehensive look at the ECG traces. ECG views. The ECG can be displayed in a number of views, including Summary, where a patient's demographics are displayed. The waveform display enables users to view 2 ECGs either side by side or in vertical layout. Users can also access enhanced diagnostic tools from the icons on the right-hand side of the screen, including viewing superimposed heartbeats, changing the format of the ECG, and accessing calipers to perform measurements. To configure the calipers, simply right-click over the calipers and view configuration options. Users can also save their user profile for future use. The report view displays the ECG in a conventional layout, as per a typical printout from an ECG machine. We'll now discuss how the digital ECG system complements the Hume algorithm for management of patients presenting with chest pain or suspected acute coronary syndrome. Once transferred to the server, local GPs, regional emergency department doctors and physicians, along with Ambulance Victoria clinicians, all have access to these images upon telephone referral by rural urgent care centre nurses and/or GPs. If the patient is triaged as low risk, the image can be remotely viewed by a GP and the patient managed locally. Data shows around 95% of chest pain presentations fall into this category. Time is myocardium. When it is clear a patient is having a heart attack or needs to get to a tertiary centre for cardiac intervention as quickly as possible, the digital ECG system complements existing methods of referral to Ambulance Victoria by allowing the AV clinician immediate remote access to the ECG images in the server. The Ambulance Victoria clinician can then transmit the digital image via email to the retrieval team and to the tertiary centre receiving the patient. If support is required from the regional emergency department, the patient will be referred using pre-existing methods, via telephone by the urgent care centre nurse or GP. For ED doctors and physicians, they can remotely view high-quality digital ECG images on the server immediately, instead of relying on faxed or photographed images. A video consultation may be required for more thorough assessment of the patient. Referral will occur through the verbal discussion between the referring nurse or GP and the ED doctor. In addition to reporting within the iECG system, details of the video consultation will be entered in the patient medical record at both health services, consistent with national guidelines for telehealth. The ED doctor may refer complex and difficult to interpret ECGs to the on-call physician. As a result of referring a patient to the emergency department for risk stratification and support, the patient will follow one of 3 management pathways defined in the Hume algorithm. High-risk patients will be retrieved from a rural health service directly to a tertiary centre for cardiac intervention. Intermediate risk patients will be transferred via ambulance to the nearest regional emergency department for further management, and low-risk patients will be managed at the local health service by nurses and the on-call GP. providing far superior images than traditional methods of fax or photos, and when combined with the patient management pathway, the Hume algorithm, iECG was the catalyst to really lift and consolidate nurses' confidence in managing this group of patients.
Knowing doctors can view high-quality digital ECG images instantly from the server has taken away some anxiety for isolated clinicians. Not having to leave the bedside and knowing that the image can be clearly seen ensures high quality and safe care for rural patients. The digital ECG system means that we can deliver the right cardiac care in the right place at the right time.